everyone. My name is Tim Reha, hosting Inform Health 2015 here at UCSF in beautiful San Francisco. Had a great pre-conversation with Alvin Rajkomar. You're a hospitalist, you're a data scientist. You sound like you're kind of entrepreneurial too, with a really cool story. Welcome to the show.
Thanks, Tim, for having me.
So what is your background?
Sure. I am a physician, and I'm also a data scientist. Yeah. So I say I'm a Bay Area local. I grew up in the heart of Silicon Valley, San Jose. Learned how to program at a young age, and was very interested in physics and chemistry, but eventually wanted to turn my interest to directly help people. So I became a doctor, and I currently work as a physician at UCSF as an attending in internal medicine.
Okay, cool. And you're doing some interesting stuff now too, kind of using a human touch, also with data analytics and things like that. Tell me your story again.
Sure. One thing I noticed was the dichotomy of technology use in my personal life and in the hospital. Where at home, you could use Netflix, Amazon, get personalized recommendations for what movie to watch, what book to buy. You'd go to the hospital and you'd do all your daily clinical work in an electronic health system, but you would never get recommendations like, hey, did you know a master clinician would have ordered an HIV test in this patient? You haven't ordered one. Would you like to order it? And it got me thinking, why can't we have those types of intelligent, not just recommendations, but technological solutions to help clinicians take care of patients better? And so I went down a path of figuring out how to get access to that data and how to become a data scientist to actually use the data meaningfully.
But you even took it further and actually took the courses and whatnot to actually get licensed to write the queries. Tell us about that.
Sure. In general, to get data from an electronic health record system, you have to go through a broad of hipsters, if I can say that, who are technicians who have direct access to the database that houses all the clinical data. But I realized when you talk to the report writers of those hipsters, they're not clinicians. And so when you ask for something that sounds simple to you, like, can I see the hemoglobin threshold of patients on whom I've transfused? The report writer doesn't realize that you mean pack red blood cells and you're interested in the hemoglobin level of the patient immediately prior to the transfusion. And so there's a mismatch between how clinicians ask questions and how the report writers interpret those questions. And so I said to bypass that process, I should just get trained at how to get access to data directly. So you had to go to Wisconsin for 2 weeks. You had to do hours of examinations to actually get direct access to the database. And so not very many physicians or clinicians do, but I did. And now that I have access, I'm learning that there are a lot of cool tools that companies like Amazon and Google use to analyze their data. And I'm starting to use those tools to analyze our data.
So what are you learning from that?
I'm learning that there are a lot of opportunities to improve healthcare and reduce costs. One of my early projects was to identify variation in blood transfusion use throughout the hospital. And we found there was significant variation, and we're able to use that as part of a medical center initiative to feed back that information to clinicians who could improve their behavior. And we were able to successfully reduce inappropriate transfusions and also save the health system over $1 million.
Wow, that's pretty interesting. Tell me another story that kind of came out of this.
Sure. One thing I'm really interested in is creating a learning health system that can proactively help patients and avoid need for going to the emergency room or going to the hospital. And so what I've become really interested in is patterns of healthcare use. That 50 years ago, you would only interact with the health system by going to the primary care doctor and then going home. But now, in major medical systems, you can go to the primary care doctor, you can email your doctor, you can telephone your doctor. And what I've done is analyze over 1 million encounters and patterns in which specific patients take. For example, you might go to your primary care doctor, get blood work, you might call in for the results and get told you need to go to the emergency room. And so by doing this for every single patient, we can identify different patterns of use. And for a particular patient, start to think about, can we identify with your particular pattern, are you at risk for your next visit being the emergency room or your next visit being a hospitalization? And can we create systems in place to send a nurse to you before that actually happens and see whether there's something reversible that can be done?
That's very cool. And probably saves a couple lives along the way, or can help reduce errors and issues.
We take this work really seriously, and what we do need to make sure is that the algorithms and systems in place are done responsibly. That if you are a company like Netflix or Amazon, and for example, Tim, if Netflix recommends The Matrix and turns out you don't like it, you maybe lose a few minutes of your life. It's really important that if we apply those same techniques and algorithms to healthcare, that we do it responsibly, that it's safe for patients, appropriate for patients. And so we spend a lot of time thinking about how to do that.
What are you looking for in terms of staff and new talent to bring into your organization?
I would say we have a major need for data scientists, if there are any out there that want to get involved in using data science to help patients and improve healthcare delivery. There's a huge need at UCSF.
So Alvin, how do people connect up with you now?
I think the easiest way is just to look me up at UCSF's website and find me there.
Nice job. So, well, thanks for being part of the event today and for a great interview.
Thanks, Tim.